Thick blood, symptoms and treatment. People with thick blood have too many red blood cells in their blood, which increases their risk of blood clots. Medication and lifestyle choices can help lower the risk of clots and other complications. People often use the term thick blood to refer to Polycythemia vera, but there are several possible causes. Having too many red blood cells can hinder the movement of blood and therefore the movement of oxygen, hormones and nutrients throughout the body, preventing them from reaching tissues and cells. It can result in low oxygen levels, hormonal imbalances and nutritional deficiencies. In this video, we look at how thick blood affects the body, what can cause it, and how doctors treat it. Causes. Thick blood is a common term for Polycythemia vera, but there are other possible causes. A high proportion of red blood cells makes the blood thick and increases the tendency of blood to clot more easily. Blood needs to coagulate to stop bleeding, for instance from a wound. However, if it coagulates too easily, it may not move freely through the body. Blood coagulates when certain factors or proteins change the balance of ingredients in blood. Health conditions that involve thick blood may be inherited or genetic, or they may develop over time. Here we look at some medical conditions that cause the blood to thicken. Polycythemia vera. Polycythemia vera is a blood disorder that originates in bone marrow, the soft center of the bone where new blood cells develop. Polycythemia vera involves the bone marrow making too many red or white blood cells and platelets, causing the blood to thicken. Blood clots sometimes occur, but the sluggishness of the thick blood can also lead to symptoms such as fatigue, headaches, dizziness, weakness, sweating especially at night, itchy skin, blurred vision and ringing in the ears, abdominal fullness or bloating due to an enlarged spleen. Experts believe that Polycythemia vera results from genetic changes that occur after conception. It is not generally inherited, but genetic changes occur slowly over many years. Polycythemia vera affects 44 to 57 people in every 1 lakh, and it usually appears after the age of 60 years, according to the National Organization for Rare Disorders. Waldenström macroglobulinemia is a rare type of non-Hodgkin lymphoma. The body produces large amounts of the antibody protein called immunoglobulin M. This can cause the blood to become thick, resulting in a range of symptoms. The symptoms vary, but they may include nosebleeds, bleeding in the gums and the retinas of the eyes as small blood vessels become damaged, anemia, tingling and numbness in the fingers and toes. There are about 1,000 to 1,500 new diagnoses of Waldenström macroglobulinemia in the United States each year, according to the American Cancer Society. Deficiencies in proteins C and S and antithrombin. The body produces natural anticoagulants such as protein C and S and antithrombin, which help prevent the blood from becoming thick. Some people have low levels of these substances, leading to a higher risk of blood clots. This may result from an inherited health issue or develop over time. The first sign of this issue is often a blood clot. The doctor may find this during a test. If a clot forms in a deep vein, The doctor may diagnose deep vein thrombosis. If a clot breaks off and travels to block a blood vessel that supplies blood to the lungs, this is called a pulmonary embolism, and it is life-threatening. Protein C deficiency affects around 1 in 200 to 500 people. Protein S deficiency 1 in 500 people, and antithrombin deficiency 1 in 2000 to 500 people. Prothrombin gene 20210A mutation. People with this genetic feature have too much of the blood clotting protein factor 2, also called prothrombin. Prothrombin is one factor that enables blood to clot correctly, but too much prothrombin can increase the risk of clots forming, including those responsible for deep vein thrombosis and pulmonary embolisms. The mutation affects 2 to 4% of Americans of European ancestry. Factor V laden. This results from a genetic changes that increases the risk of blood clots, especially in deep veins. In most people, a protein called activated protein C regulates the activity of the clotting factor called factor V. In people with this condition, protein C cannot regulate factor V's activity, resulting in thick blood and a risk of clotting. Unregulated factor V activity leads to excessive clotting and thickened blood. Thick blood can develop over a lifetime due to environmental factors or health conditions. Risk factors including smoking, hormonal changes, for example during pregnancy, hormonal medications such as some forms of birth control, hormone replacement therapy and testosterone therapy, inflammation possibly caused by SLE or inflammatory bowel disease, trauma and injury, some diseases such as cancer. Symptoms. Thick blood often produces no symptoms. The first sign may be a blood clot, or a person may experience symptoms related to the underlying health condition. A person may wish to consider testing if they develop a blood clot of unknown origin, have repeated blood clots, experience recurrent pregnancy loss, have a family history of thick blood or blood clots. With testing, a doctor can assess the risk of some medical conditions related to thick blood. Treatment. For health conditions that affect blood clotting, doctors may prescribe drug-based treatments such as antiplatelet therapy. Medications such as aspirin can help prevent blood cells from forming clots. Anticoagulation therapy. Some drugs such as warfarin act on coagulation factors to prevent clots. Thrombolytics. Doctors may use these clot-bursting drugs in emergency situations. Also, protein C and antithrombin factor may be suitable for some people. A doctor will also only prescribe medication if a dangerous blood clot has formed or they suspect that the person has an increased risk of clotting. Doctors may also recommend quitting smoking and avoiding second-hand smoke, losing weight if necessary, doing regular physical activity, avoiding sitting for long periods, moving the legs and feet frequently to support blood flow. Complications. Thick blood disorders can lead to a range of problems, including deep vein thrombosis and pulmonary embolism. When a blood clot affects a deep vein, a doctor may diagnose deep vein thrombosis. These clots tend to affect the large veins of the lower legs, but they can form in the thighs, arms, abdomen, or pelvis. In the area of a clot, a person tends to have pain and circulation problems. Specific symptoms of a deep vein thrombosis include swelling, redness, and warmth in the area, a sudden or gradual onset of pain, leg pain when bending or stretching, leg cramps in the calf, bluish or pale skin discoloration elsewhere in the body. Pulmonary embolism. A pulmonary embolism can occur when part of a clot detaches and travels to the heart or lungs. If this happens, the fragment can cause a new clot, block blood flow, and interfere with gas exchange in the lungs. A pulmonary embolism is a life-threatening emergency. Symptoms of a pulmonary embolism include shortness of breath and rapid breathing, a rapid heartbeat, pain with deep breaths, blood when coughing, chest pain. Other complications. Other possible complications of blood clots include stroke, heart attack, kidney damage, pregnancy complications, peripheral artery disease.